Hello, everyone. I will be sharing data exploring how treatment choices, patient behaviors, and demographic factors influence diabetes outcomes. The goal is to show how evidence based nursing practices can improve patient care and their management to maintain an overall healthy lifestyle. Analysis of a diabetic patient data set. The focus on treatment type, compliance, exercise, BMI, and A1C. The purpose is to identify trends that guide nursing interventions. This study is reviewed multiple patient characteristics to determine which factors play the greatest role improving glycemic control. As recommended by American Diabetes Association, to 2024, the goal is not only to summarize data, but also to interpret its significance within a clinical context. This study reviewed multiple patient characteristics to determine which factors play the greatest role in improving glycemic control, as recommended by American Diabetes Association. The goal is not only to summarize data, but also to interpret its significance within a clinical context. Mean, in slide number 3, we have mean age and gender distribution varies from that category would be 52.36. Gender distribution would be 12.5. And this is a series of 25 total patients, and that would be 13 male and 12 females. A nearly balanced gender distribution supports the generalize of the results, finding and apply broadly to adult male and female diabetic patients, which strengthens the conclusions according to the analysis provided. Ethnicity distribution. Hispanics play a category of 7 particular individuals. Caucasian whites would be 6, African Americans would be 7, and Asians would be 5. Diversity supports culturally responsive interventions. Of all the categories involved, the largest groups were African Americans and Hispanic participants. Culturally informed care strategies should be prioritized with these populations. This aligns with research emphasizing culture sensitivity in chronic disease education. On slide number 5, we are going to cover treatment type in regards to A1C and the reduction. Change by treatments. When combined with a combo therapy, we have coverage of 4.2% shown to be reduced in their A1C. So basically, if they have a combination of therapy, would be a better factor. Now we have people that are just taking insulin. We have a coverage of 3.5%. Overall, and oral medications would be 3.0. Exercise and diet would be 3.0. So when providing a combo therapy again, they produce the greatest improvement overall with a less number figure of A1C, meaning that their diabetes would be controlled a little better. This is slide 5 again, but this would be part 2. The treatment lowered the A1C, although the reductions varied. When performing combination therapy, it showed the largest improvement, suggesting that multiple approaches may be most effective for high-risk or treatment-resistant patients. This study has found blood glucose management taking their medication, being compliant, and adherence, preparing their own foods per their doctor's recommendation, as per individuals' needs, and according to their level of education, maintaining a normal BMI and daily blood glucose checks at home makes a substantial difference in their overall health. And I have a graph here that would, according to the visualization that we did earlier, in the first beginning of the weeks that week 6 to be exact, these were the statistics that were provided for us. Um, we got slide again, number 5. Oh, sorry, excuse me. So now we have slide number 6, compliance in hospital admissions. Non-compliant patients have shown to be the highest admissions and overall of between 10 to 15, whereas the compliant patients have shown to have a decrease in fewer admissions, ranging from between 1 to 4. This is reflected by maintaining compliance with their diet and incorporating the daily exercise at least 3 to 4 days a week. This includes self-administering their daily diabetic medications. They can have a reduction if they maintain, if they pretty much if they um, sustain and maintain a regular diet and incorporate their daily medication, diabetic medication, their glucose will prevent them from going to the hospital. A strong association between adherence and reduced hospitalizations. And this is a brief graph that was also provided in compliance in hospitalization admissions for the ranges here. Um, This is part 3 for slide 6. The clearest pattern in the data is people who were non-compliant were strongly linked to increased hospitalizations. Nursing practice can reduce the risk through ongoing education, reminders, digital tools, and follow up with their patients via electronic phone calls, emails, reminders, or special data. Exercise frequency and A1C. If patients maintain compliance to incorporating more frequent exercise, they may have a higher percentage of reducing the A1C blood tests. By doing this, they stabilize their blood glucose in their body. Patients that exercise 4 times a week improve most of the time. With minimal exercise, obviously, the less that you do, your overall improvement will not improve. Or sometimes may not improve at all. So basically, what they're saying is like if you exercise, if you're diabetic, it's encourageable for you to go ahead and exercise and do some kind of activity so that you can reduce the blood glucose. Mhm. And again, this is other graphs that were provided for us. That would be the exercise frequencies and changes, variation number here, the graph that was provided. Uh, when people incorporate regular physical activities, again, we're going to touch base on that again. It was noted to improve insulin sensitivity and blood glucose control. These results reinforce the existing clinical recommendations supporting exercise as a core component of diabetes management and maintaining normal ranges. Again, this is another graph that was also provided in regards to the BMI and initial A1C. The higher the BMI is associated with, obviously, diabetes. The higher your BMI, the more prone that you can not have your blood glucose at a normal range. Even though the relationship was not perfectly in line, uh, within each other, the upward trend was self-explanatory. So patients with higher BMIs tended to begin with poor glycemic control. This supports the intervention focused on weight management, nutrition, and changes in their lifestyle. Maintain modifications makes a difference in regulating the blood glucose. Individuals who maintain their frequent checkups have shown better glycemic improvements. The individuals who have been inconsistent with their follow-up linked to minimal, they have their A1C changes or not at all indicate they are non-compliant and and are at high risk for deterioration in the disease process of diabetes. This aligns the importance of reinforcing the continuity of care and that it's essential to incorporate in an overall healthy lifestyle. Again, these are also some more demographic graphs that were provided while we did the visualization in week 6. And just to retouch base, here are some factors. And by maintaining their regular checkup appointments, providers can adjust treatment when needed or reinforce education on a diet, low carbs, low sugar, low sodium, would identify, and they can by going to the doctor, doctors can identify issues early in time. In addition, by implementing an ideal structure regimen focused on the individual, it can significantly enhance a long-term diabetes control for the patient. If they understand how to manage diabetes, they have better outcomes. As far as conclusions and recommendations, it has shown that incorporating combo therapy is most effective. We're talking about between 4.2%. All treatments reduce the A1C. Definitely is better than none, but it definitely is better to incorporate a combo of therapy to be able to maintain your blood glucose at a normal range. Non-compliant participants are strongly linked to more hospitalizations. Higher BMIs are linked to higher initial A1Cs. More exercise and more checkups are encouraged to have an overall better outcome. And cardiovascular diseases plays a big, most common risk factor in complication, inclusive to diabetes. The recommendations that are provided that would be best would be to expand combination therapy for high risk patients. That's definitely encouraged. We're talking about exercise, medication regimen, possibly resources, group efforts, and exercising would be definitely helpful for them. Implement compliance tracking tools, for example, EHR alerts, reminders, provide culturally adapted education, and add EHR integrated cardiovascular risk screening, a strengthening exercise and lifestyle programs that would be of interest to the patients, enhance follow-up systems with telehealth and reminders would help them as well. These measures strengthen and enhance proper diabetes care by incorporating a combination of proper therapy earlier in time, enhance adherence, support from the patients. They also are willing to follow up with them managing diabetes. So basically, if they understand how to deal with the diabetes, they have better chances to incorporate a better lifestyle. They are more inclined to maintain compliant. The providers need to provide culture strategies that can assist patients with their care. Healthcare providers can reduce complications and improve overall more essential health to their patients' outcomes. Overall, this data storytelling project emphasizes how data-informed nursing practice can significantly improve patients' outcomes, integrating technology, targeted education, and personalized interventions can reduce hospital admissions and enhance quality of life for patients with diabetes. These recommendations support a shift toward preventative, patient-centered care that is efficient, equitable, and sustainable. And below here, as you can see, these are the references that I was able to use. Well, thank you. And I hope you guys were entertained and you learned something in regards to diabetes.